A new $15 million veteran mental health precinct will be built on the Glenside campus. This will incorporate an inpatient unit, specialist services for post-traumatic stress disorder, rehabilitation and research spaces.
The Veterans Mental Health Precinct offers us an opportunity to both look after those who have previously served as well as those who are currently serving and those who will continue to serve 50 years forward from now.
Well, as a Vietnam veteran, I think the facility at the repat has seen its day. What we're going to get at Glenside is a very, very flexible and modern facility. It also provides a base for development in the future.
An oversight committee and 5 working groups have been established to support the development of the Veteran Mental Health Service Precinct. The building design group has been set up in a way to gain an active participation from veterans, consumers, the clinical staff team and wider stakeholders. The building design group then has looked around the patient pathway. We've had a real clear focus on being patient and person-centred in our care, and the model of care will reflect that. So the new areas that we've not had have been the all individualised bedrooms. We've actually looked at enhancing the observation points, which means that the nursing station within the clinical area is central to the service.
My role is to make sure that the needs of women are being addressed, and to make sure that women who go into this new facility feel secure. My understanding of the new facility is it's going to cater for my generation of veterans.
So I'm chair of the Model of Care Group, which consists of representatives from veterans, clinicians and people who've got a broad ex-service organisation interest in the welfare of veterans and their families. The role of veterans in this whole process are to bring the whole experience of their illness, but also experience of what works best for them individually and as families in treatment.
I was diagnosed with post-traumatic stress disorder, and the soldiers coming home now are facing different problems than what they were facing back 20, 30 years ago. We can build something fresh and future-proof for these veterans coming home now.
Research will be integral to this program. It'll be very strongly focused on treatment, but in addition to that, looking at family issues, well-being, prevention and early intervention, a broad focus on research which can really make this precinct absolutely world-class.
Our role on the Memorialisation Working Group is to make sure that the mental health facility is memorialised in a way that enables us to retain those links that we've had with Door Park for so long. So it's very important that we look forward as much as we look backwards.
The Partnerships Working Group is focusing on creating a collaborative environment for all of the ex-service organisations in South Australia. The partnerships will support the clinical care that's being provided at Glenside through a whole variety of ways. One of those ways will be social activity, one will be physical activity, one will be providing information and linking to services that support them and their families.
I think partnerships are important because the veterans and the community need to see that we're all working collectively for the best possible outcome for veterans' health. Of those that I've spoken to, I think the opportunity to create a veterans' health precinct that covers all of their needs and allows for their family and their friends to be a part of that rehabilitation, I think they see that as an exciting opportunity.
From the contemporary veterans that I speak to, they are all excited about the opportunity to have a facility where they know they can go and they will receive first-class treatment that is well researched and has their well-being in mind.
Having been through the existing system, I think this will be a great improvement for veterans such as myself. It will bring a more positive feel for the veteran going into this facility, and that's what they're after, a new, fresh type of start.